This right here is actually a pump to give a patient liquid food. This would be connected to the patient's tube, and then we would program the numbers in here on how many mLs per hour it should go. Okay, if we're going to give a patient's meds, we obviously have to turn this off because we don't want to mix the food and the medication together. So often what will happen is you may get an order to stop the feeding 30 minutes before you're going to give meds. So if I'm giving meds at 10 o'clock, I'd turn this machine off at 9:30, and then I would let the patient's belly have a little rest, and then we would go ahead and give our medications. Now, before we go back to the patient's room, of course you're going to look over what meds are due, and you're going to crush any meds that need to be crushed. Okay? So let's say, for instance, I'm giving my patient this medication. This is the medication I'm giving them. I'm giving them half a tablet of lisinopril. Okay? So first, before I crush it, what do I need to make sure?
The right dosage.
The right dosage, right? So let's go over our patient rights.
Your right patients,
Right medication.
right documentation,
Right time. Dose.
You already said that, yeah.
right route.
Right route.
I feel like that's everything.
Time.
She said time
Oh,
already.
right to
Indication,
refuse,
right? The right
indication.
reason to give it, right? Okay, so what you're going to do is you're going to crush it. Like a lot of units will have these. I've been on some units where they just have a hard rock that they use to crush the med, but this is a professional type crusher. See this little pocket here?
Mm-hmm.
You stick that in there, and you put it on a flat surface. Okay, and now it's nice and crushed. Did I do a good job, Rebecca?
Mm-hmm.
Yeah. Okay, so I would do all of that before I go back to the patient's room. I would get all the meds ready. And so I'm going back to the patient's room now, and I'm going to go ahead and check for placement.
Mm-hmm.
After name and date of birth, I'm going to check for placement, and then I'm going to give the medications. All right? So the first thing I'm going to do is I'm going to take my syringe. I got to make sure I have the right kind of syringe. Usually, if it's a special, some tubes have a special syringe that comes with them, like this tube right here does. This one, we can use this big catheter tip syringe. So I'll take about, I don't know, 50 to 60 of air, and I'll inject that air, and then I'll pull back. What am I checking?
Gastric contents.
Yes, we're checking the gastric residual volume, right? If it's greater than 500, we're going to hold it for 2 hours and notify the physician. Okay? So after we get some gastric contents in there,
How much are you pulling back?
I pull back as much as we can get.
Okay.
Okay? Sometimes there'll be nothing in the stomach. Okay? And then I'll take that and I'll take my pH paper. I'm not going to take it out. I'll take out my pH paper and I'll squirt a little bit of the gastric contents onto that.
Okay,
And
that's
then-
how you measure for the 500.
No, to measure for the 500, you just keep pulling out.
Mhm.
You just keep pulling out. And you would put it in here and keep going to see how much is left in the stomach. I can tell you that if I'm getting 200 mLs, I will usually call the doctor, but the book says 500, which is a lot. That's like half of this. Half of this is 500. That's a lot. So sometimes just waiting 2 hours so the food can digest a little bit more might be helpful. So I would go ahead and take the pH paper and I'd squirt it, and then I would compare on the pH scale the color with the number. Okay, so we're going to look for about 5. That tells us that the liquid that I took out through the tube is in the stomach. 5. Okay, so now I've checked my gastric contents, and I put any leftovers back in their stomach. I'm going to close it up. And now I'm going to prepare my medications. So I know that I'm going to flush the tube in the beginning with about around 30 mLs. So I'll fill this up to make it 30. And then I have my powder, and I'm gonna mix that with about 15 mLs. Then let's say I'm giving a liquid medication. And that's about, let's say I'm giving 10. You always want to wear gloves while you're doing this. And then how much am I going to flush in between medications? 15, yeah, 15 to 30. 15, and then I'm going to finish off with at least 30. Okay? So I've checked placement, I've checked my pH. So what I'm going to do next is I'm going to give my medications. Okay? So the first thing I'm going to do is I'm going to give my flush to flush the tube. And then my next one is going to be my medication. Then I'm going to flush that with water. See how it's just draining through?
Mm-hmm.
And then I'm going to get my second medication. And then I'm going to finish off with my last flush of water. And now I'm done. I'll close this off. And usually I'll wait about 30 to 60 minutes depending on the order, and I'll reconnect their feeding. Okay?
I have a question.
Uh-huh.
With all the